Before palpating patients, it's important to always ask for consent. The pubic symphysis is a cartilaginous joint that sits between and connects the left and right pubic bones. To palpate on a patient, you first ask for consent, and then you'd have them lie supine, and you could palpate the front side of the pubic symphysis softly. To palpate the AIS, have your partner lay supine on the table, put a bolster under their knee, locate the ASIS and palpate about 1 inch inferior and medially. You can have your partner flex their hip to make sure you're in the right place. You should feel the tendons underneath. Okay, next is the sartorius. To palpate this, you have your partner lay supine and rest their foot on their opposite knee. Okay, the hip should be flexed and laterally rotated. And then you ask them to bring their knee to the ceiling. Go ahead. You should be able to palpate the sartorius right here. To palpate the rectus femoris, have your partner lay supine on the table with their knee bolstered. Locate the AIS and the patella and draw an imaginary line between the two. The rectus femoris is about 2 to 3 fingers wide, and you should be able to strum across it. You can also ask your partner to flex their hip and pick their leg up off the table. Go ahead. You can palpate the rectus femoris right here in the mid-thigh. To palpate the adductor longus, you have your partner lying supine with their hip flexed and externally rotated. Then you can place your hand on the mid-thigh and ask your partner to adduct against resistance. You can feel the contraction and follow it proximally so you can feel the tendon of the adductor longus. You then follow it to mid-thigh, and the muscle belly should lead you to the mid-thigh. That's how you know you're palpating the adductor longus. To palpate the adductor magnus, you have your partner lay on their side and flex their top hip while keeping their bottom leg straight. You can then ask them to adduct their bottom leg slightly. You should feel the adductor magnus come off the adductor tubercle, and you can palpate it proximally to the ischial tuberosity. To palpate the adductor brevis, you have your partner lying supine with their hip flexed and laterally rotated. You ask them to adduct against resistance. You can feel the adductor group flex. The adductor brevis is deep to the gracilis and the adductor longus. You're going to have to palpate a little bit deeper, and you'll feel it insert into mid-thigh. To locate the TFL, find the ASIS and place the flat of your hand posterior and distal to the ASIS and iliac crest. You can ask your partner to medially rotate and relax their hip, or you can do it for them, and you can feel the TFL contract underneath your hand. To palpate the gluteus medius, you can place your hand from the ASIS to the PSIS, and then place your other hand on the greater trochanter. This is going to create kind of like a pie shape. So that's the outline of the glute med. So you can palpate in here from the iliac crest to the greater trochanter to find the fibers of the glute med. Then you can ask your partner to abduct their hip, and you can feel that glute med contract. To locate the IT band, you have your partner sideline with the bolster between their legs. First, you want to locate the biceps femoris tendon on the lateral side of the back of the knee. And then you just roll your fingers anteriorly. You can feel the IT band. It's about the same size as the biceps femoris tendon. You can check that you're on the IT band by asking your partner to abduct their hips and then relax. You should be able to feel the IT band's fibers under your fingers, and then just follow it proximally as it gets thinner and black.